So in effect, it's another physician that takes a biopsy from a patient, essentially buys the processing or sets up a mini lab, tries to do it himself, uses a pathologist as essentially a high-paid tech to read the slide, and is able to make a margin. And as you can imagine, this has been extremely abusive. Once physicians are incentivized to make money in this way, the number of biopsies they will take will be higher. They will be more likely to biopsy a patient, whether they need it or not. This happens, okay? Because at the end of the day, it is a revenue stream. That has cheapened what I do as a pathologist. And I tell patients the first thing they should always ask is, who's reading my biopsy? And of course, there's a lot of hoopla about all this because, as you can imagine, people who are doing this, of course, are hiding behind the facade of quality and, speed of diagnosis and all this. And I will be the first to point that it's all nonsense.
That was my question, has the quality then of the results gone down because of the lack of ownership of what they're actually reading or doing?
No, well, think about it. There's no control. Yeah. The pathologist that actually is going on Monday to office A, Tuesday to office B, Thursday to office C, who's watching what they're doing? What are the controls? Hospital-based pathologists or pathologists who are practicing in legitimate large laboratories, there is oversight. My work is subject to the review of my colleagues. It is subject to the review of my clinicians. If I make a mistake, I can't get away with that. There are consequences. There is proficiency testing. There is scrutiny, where you have a pathologist, a traveler pathologist going from one place to another to a third. Who's watching that? But that question has not been asked.
Until now.